Hi everyone, my name is Marcela Gomez from Culture Shift Team. In this short video, Dr. Shibao from the Vanderbilt Autonomic Dysfunction Center at Vanderbilt University Medical Center will share information about RECOVER-AUTONOMIC. This research includes 2 studies focused on autonomic dysfunction symptoms related to long COVID, such as fast heart rate, dizziness, and fatigue. Dr. Shibao, thank you for being here with us. What is RECOVER-AUTONOMIC about, and what is your involvement?
RECOVER-AUTONOMIC is an effort from NIH that is focused on trying to find treatment alternative for patients with long COVID and autonomic symptoms. So we are testing 3 different interventions as part of RECOVER-AUTONOMIC, focused mostly to improve symptoms. And of course, feelings of dizziness and lightheadedness are, the primary symptoms associated with autonomic dysfunction.
Why are these studies important for people with long COVID and their loved ones?
There is a good percentage of patients with long COVID that develop an autonomic dysfunction. And specifically, they develop a disease called POTS, that stands for postural orthostatic tachycardia syndrome. And the patients who present with this condition have these chronic feelings of fainting, significant palpitation, dizziness, lightheadedness, and these are symptoms that are chronic. And of course, they are very disabling in some of our patients with long COVID because they cannot work, they cannot continue, some of them, their education, and that, of course, negatively impact their life and the life of their loved ones.
How would someone know if they had symptoms of autonomic dysfunction after a COVID infection?
The patients who have autonomic dysfunction present with feelings of fainting, dizziness, lightheadedness, palpitation. We call that tachycardia, which is a rapid heart rate, mostly upon standing. So if the patient with long COVID have these symptoms, there is high suspicion for an autonomic dysfunction. But of course, the most important thing is for the patient to talk to their primary care providers and discuss these particular symptoms and see they are a good fit for this type of trial.
What can participants expect if they are eligible to join?
There are different interventions that we're testing in RECOVER-AUTONOMIcs. One of them is an agent that is a pill that actually is focused on trying to slow down the heart rate because, as I said before, it's one of the major symptoms that these patients with autonomic dysfunction have. The other medication is an infusion. It's an infusion of a medication called IVIG, and it's a weekly infusion. And the third intervention, it will be what we call non-pharmacological measurements, lifestyle modification, either with an intensive care, which means that it's supervised, versus people who are going to receive some information about this non-pharmacological measure, but without additional supervision by a coordinator.
Do participants know in which group or which study they're going to participate in advance?
No, they won't. So for each intervention, we have a control group. For example, for the infusion of this particular medication, it's called IVIG, they're going to have a control, which is another infusion without any active component.
In what ways do you see RECOVER-AUTONOMIC being patient-centered in this approach?
Well, we have invited patients with long COVID, their caregivers, as well as representatives from the community to participate in the study design. But we don't want to stop there. We want them to participate in all aspects of the study conduct, and we welcome all their suggestions and recommendations to improve the RECOVER-AUTO study.
Thank you for sharing this valuable information, Dr. Shibao. If any of you would like more information about Recover Autonomic, please visit trials.recovercovid.org/autonomic. Thank you for your interest in advancing healthcare in your community.